everyone for coming out today. My name's Teresa Schaefer. I'm an organizer with CWA. I'd like to introduce our first speaker today, Ryan Rice. He is the president of CWA Local 1111.
Good afternoon, brothers and sisters. My name is Ryan Rice, and I'm proud to be the president of CWA Local 1111, representing frontline healthcare workers at Arnot, Ogden. Thank you for coming out today to listen to and support our workers in our community. This community depends on caregivers working at Arnot, Ogden. They are the backbone of our community, and they go to work every day to make sure that we all stay safe and receive the care and treatment we need. Oftentimes, our members are put in situations that require them to take care of more patients than they feel is safe. If they speak out against this unsafe practice, they face punishment from management. This has created a climate of fear and discourages others from raising these or other important safety issues, which in turn jeopardizes patient care and worker safety. It doesn't just affect them, it impacts our entire community. An attack on our healthcare workers is an attack on all of us. We must stand together to protect those who care for us. We're fighting hard at the bargaining table and with the state to push back against this despicable practice that has become routine within the walls of Arnot, Ogden. But our efforts can only go so far without the support of each and every one of our community members. We need you to stand together with us to say enough is enough. We won't sit back and watch Arnot, Ogden fight against what is right. Our community is at risk. If you haven't already, I urge you to sign our petition right now to tell this hospital to stop their attacks on us and come to the table to work together to improve care. Our members have always been there for you in times of need. Now it's time for all of us to stand with them. Thank you for coming out today. Appreciate it.
What do we want? What do we want? When do we want it? Now! What do we want? Contract! When do we want it? Now! What's disgusting? Disgusting! What's appalling? What's installing?
Thank you, Ryan. Next up, we have John Klein. He's a staff representative for CWA National, and he will be providing an update on how bargaining went today with management.
Hi, everyone. Talk directly to you guys. It's the same thing. It's going slow. We had some proposals across the table. We have a lot of things that they just rejected. We have 6 more days before this contract expires. We have a lot of work to do. I have faith we'll get it done. We have a great bargaining team, but we need your help inside. We need you guys talking it up. We need you telling management that you want a contract now. That you want to have a contract now, not just out here chanting it. Inside, you got to be telling management you want it. We have 9 articles that they just rejected. No counter, nothing, just rejected them. And we have to get them at the table. They've been there 3 hours a day for 5 days. That's all we're bargaining. We've added a couple more days. We've added a few more hours to those days. But we have a lot of work to do, and we need your help. You are key to getting this contract done. This is a great show tonight. Keep it up. Really, we need your help immensely. Thank you.
Thank you, John. Okay, next up we have Tasha Lamb. She is a unit clerk in the ICU, and she was formerly the head of the clinical staffing committee for the hospital.
Hello. My name is Tasha Lamb. I am a proud member of CWA Local 1111. I have been a unit clerk at the Arnot Ogden for 14 years, following in my mom's footsteps as a unit clerk who has worked for Arnot for 47 years. Today I stand before you with both a heavy heart and a burning determination to address the extremely difficult working conditions of the frontline healthcare workers of Arnot Ogden due to severe understaffing. Currently, we are bargaining a successor contract, and one of the issues that we want to address is safe staffing. When we're forced to take on more and more patients because the hospital isn't adequately staffing, it puts an unbearable strain on us as workers. It pushes us to our limits and makes it harder and harder for us to deliver the quality care our patients deserve. Short staffing also compromises patient care. It threatens our community. When healthcare workers are short-staffed, we're forced to make impossible choices, sacrificing thoroughness and compassion because there simply aren't enough of us to go around. What's even more infuriating is that management is not just turning a blind eye to this staffing crisis, they are actively working against our efforts to address it. Rather than addressing the legitimate concerns of frontline healthcare workers and working with us on a solution, hospital management has actually taken steps to undermine our efforts. Their indifference to our issues and our well-being is heartless, and patients bear the consequences. As Local 1111 Staffing Director, I believe I have been targeted and punished for speaking out for safe staffing. After working for a year to implement our hospital staffing plans and improving staffing, I've been removed from the hospital staffing committee and banned from attending meetings.
That's not right.
All while management sets new staffing minimums behind our backs. And this goes way beyond just me. Our members have been threatened with being fired for just wearing buttons, calling for safe staffing, higher wages, and to end mandation. This is unacceptable. It is a direct attack on our rights as union members and our duty as frontline healthcare workers to advocate for safe and effective patient care. It's ridiculous to tell healthcare workers that they can't speak out for better patient care. We're here today to declare that this will become an emergency if not addressed. Arnot Ogden Medical Center must do better. They must commit to meaningful changes both at the bargaining table and in their daily operations. Our well-being depends on it. We will not be silenced. We will not back down until we achieve a safe and healthy workplace that we deserve. Thank you.
Hey, hey, ho, ho, unsafe staffing's got to go. Hey, hey, ho, ho, unsafe staffing's got to go. Hey, hey, ho, ho, unsafe staffing's got to go. Hey, hey, ho, ho, unsafe staffing's got to go.
Awesome. Thank you, Tasha. Next up, we have Dora Leland. She's the president of the Chemung and Schuyler County Central Labor Council.
Thank you, and thank you all for inviting me here tonight. Like Teresa said, my name is Dora Leland. I'm actually a 7th grade history teacher, 34 years now, and it's June, so you know what this is like. I've been a union member my entire working career. I started out at 18 years old as a member of the Meat Cutters Union. I worked in a deli, and my first day on the job, I signed my union card. I have always, my whole life, embraced and cherished my union membership. I'm currently the president of the Chemung Schuyler Central Labor Council, and I also sit on the board of directors for both our state teachers union and our national union. I stand in solidarity today with my union siblings from CWA to express my strong opposition and disgust at the harmful practices that Arnot Hospital Administration has been employing. They can be called nothing less than what they are, union busting. Union busting refers, in case you don't know, to the deliberate and systematic efforts undertaken by employees to undermine and dismantle unions. It is an all-out attack on our fundamental rights as workers to organize and fight for better conditions. What union busting tactics has Arnot Hospital employed? Well, they've threatened to fire any employee wearing a union button during working hours, even though this is a commonly accepted practice for years. They have also banned badges with a QR code that provides members with a link to file complaints. Instead, now all staffing complaints must go directly to management, leaving the union with no access to these complaints. Gee, I wonder why that is. Members have also been kicked off staffing committees, the very committees that are charged to solve the issues of staffing that directly impact workers, but also patients at the hospital. So as a history teacher, I fully understand the critical importance of labor unions, not only the impact that they've had on members, but really for all people of society. They strengthen our stability and our strength as a community. Unions have always played a vital role in protecting workers' rights and ensuring fair treatment in the workplace. More importantly, they provide a collective voice for employees, giving them the power to negotiate for better wages, improved conditions, and benefits that enhance the quality of life. This is exactly what the healthcare workers at Arnot are doing as they fight to negotiate a just and equitable contract that protects safe staffing ratios. Unions have been instrumental in securing many of the rights that we enjoy today. However, despite the proven benefits of unions, there are those who seek to weaken and destroy them. This is what the Arnot administration is doing. They are using tactics that create an environment of fear and insecurity that often prevents workers from exercising their right to effectively organize. Union busting not only undermines organizing, it undermines the democratic principles that our society is built upon, eroding the balance of power between workers and employees. So, I ask you today to stand with us. Know that union is behind you. What Arnot Hospital is doing is unacceptable. They are deliberately undermining the ability of CWA to collectively organize and advocate for their members. We must stand together against this blatant union busting and support the workers' rights to bargain collectively. We need to work for a future where all workers are treated with respect and dignity, where workers are fairly compensated for their contributions, and where their power and autonomy to defend themselves is not diminished. I stand in solidarity with you. Thank you.
What's disgusting?
Union busting!
What's disgusting?
Union busting!
What's disgusting?
Union busting!
Thank you so much, Dora. Next up, we have Tammy Girardi. She's the VP of Healthcare for CWA Local 1111, and she is a sterile processing tech at Arnot.
All right, thank you everybody for coming out. What do we want? When do we want it?
Now!
Thank you. Hi, my name is Tammy Girardi, and I have been a member of CWA 1111 for 30 years. As a member of the bargaining committee, I want to take a few minutes to talk about our fight for a fair contract. Every single one of our priorities centers around better staffing for the benefit of workers in our entire community. We are not just fighting for ourselves, we are fighting for our families, our neighbors, and our communities. Our wages are not just a number on a paycheck. They are what allow us to provide for our families and attract new healthcare workers to the bedside. Right now, our wages are so low that a clinical assistant could quit today, go work at Arby's, and make over $5 more per hour. This makes it harder to recruit new healthcare workers and makes short staffing. And it means that hardworking caregivers struggle to put food on the table or choose to leave the profession altogether. This is unacceptable. Another urgent issue that we're facing is when management forces us to work beyond our normal shifts, sometimes up to 16 hours straight, because management has failed to provide enough staffing to keep our patients safe. When we're required to work for this long, it stretches us to our breaking points, putting both ourselves and our patients at risk. In fact, one of our members who was mandated and forced to work an overnight shift without notice was so tired when they left their shift at 7 a.m. they got into a car accident. Exhausted healthcare workers cannot provide safe, effective care. Would you want to be the patient taken care of by someone on the 16th hour of work? This has to end. What's at the heart of all these issues? Staffing. Proper staffing levels are key to delivering the high quality care our community depends on and to make sure that workers stay at the bedside. Without enough hands on deck, we cannot do our jobs properly and our patients suffer. So we cannot back down until we win a fair contract for ourselves, our co-workers, and our community. Thank you.
Hey, hey! Oh, Navigation's got to go! Hey, hey! Oh, Navigation's got to go! Hey, hey! Oh, Navigation's got to go!
Thank you so much, Tammy. That concludes our press conference. Thank you to everyone who came out today. And we have some more chants. This staffing is bananas. B-A-N-A-N-A-S. This staffing is bananas. B-A-N-A-N-A-S. This staffing is bananas. B-A-N-A-N-A-S. When I say staffing, you say saves lives. Safe staffing.
Save lives.
Safe staffing.
Save lives.
Safe staffing.
Save lives.
Safe staffing.
Save lives.
What do we want?
Contract.
When do we want it?
Now.
What do we want?
Contract.
When do we want it?
Now.
If we don't get it.
Shut it down.
If we don't get it.
Shut it down.
If we don't get it.
Shut it down.
Thank you.